Our next presenter is Dr. Rodriguez. The title of the presentation, Analytical Determination of Methylone and Metabolites in Brain Tissue by LCMS-MS. Thank you, Dr.
Hello, next. Hello, everyone. This is an overview of my presentation, which includes a little background on my research project, the research approach that I use, data, discussion, and future directions. Next. Methylone is a psychoactive drug of abuse that belongs to the synthetic cannabinoid family. It is an illegal drug better known on the streets as bath salts, and during the last decade has been targeted as a public health threat due to its high addictive properties. Methylone has been known for having amphetamine-like characteristics in terms of its mechanism of action. However, not much is known about its pharmacological effects in the brain. So for this reason, scientists have been working on the development of efficient analytical techniques with the purpose of using them as a tool to study the pharmacokinetics and pharmacodynamics of this drug in diverse biological specimens. Next. For this project specifically, my goal has been to develop and validate a reliable analytical method based on LCMS-MS, which is a very known analytical technique for the quantitative analysis for multiple compounds. So this method not only seeks to identify and quantify methylone and metabolites in rat brain tissue, but also it helps to be used as a tool to study the pharmacological behavior of this drug in the brain. Next. So the way I developed this method was basically by following a series of parameters for method development that includes sample preparation, techniques, LCMS analysis, and validation. Next. So sample preparation consisted of a series of procedures for drug extraction from the brain tissue. This included homogenization of methylone dose rat brain in buffer solution, beta-glucuronidase hydrolysis, protein precipitation, evaporation, reconstitution of samples, and filter virus for analysis, which was done by using LCMS-MS instrument equipped with a synergy polar RP column and a triple quadruple mass spectrometer. After LCMS-MS analysis, different experiments were performed during a process of validation, and the validation process estimates the efficacy and reliability of the method, but also provides any method limitations under normal conditions. Next. So after analyzing the samples by LCMS-MS, we obtained results that indicated the distribution of ions by mass, as well as the retention time of each analyte, which is basically the time from injection to detection of the drug. This was translated into chromatograms that show different peaks for each analyte, and these peaks represent the retention time versus the intensity of abundance of each drug detected. Next. The results for method validation were evaluated by following parameters established by a scientific working group for forensic toxicology. In the method validation, we tested for calibration, bias, imprecision, matrix effect, extraction, and process efficiency. So most parameters presented a coefficient of variation within 20% according to the guidelines for method validation, which makes this method reliable in terms of sustainability. So in addition to that, all experiments for validation were performed using quality controls to preserve the integrity of the method. Next. A total of 10 authentic brain samples were tested for methylone and metabolites. The concentration range for the analyzed in authentic brain samples was from 5 to 2,250 nanograms per gram. Analyzed that registered the highest reliable concentration were methylone, MDC, and HMMC, while HMC was not detected during the analysis. So multiple reaction monitoring chromatograms were obtained to observe the distribution of ion by mass, intensity of the analyte versus retention time, and concentration. Next. So based on the results that I got and the guidelines from the SLDG talks, this analytical method was proven to be sustainable and reliable for the identification and quantitative analysis of methylone and its metabolites. Future directions include the incorporation of this method for the quantitative analysis of methylone in forensic and clinical settings, as well as the use of this tool to study pharmacological effects of methylone in the brain. Next. Finally, I would like to thank the whole Dr. Conchita Design Lab for all the support and all the lab members that were directly involved in this project, and of course the institutions that made this event possible, such as CSF and NSF and PRISM staff.
Thank you, Dr. You have one question. Could this method be adopted for other clinical applications?
Well, based on the literature has shown different methods for methylone based on LCMS. However, this method was created specifically very unique and designed specifically for identification and quantification of this drug in rat brain. But in order to be useful for other biological specimens and other techniques, it needs to be reevaluated for the whole method based on the type of biological sample, such as urine or blood. And we have to reconsider all the parameters again, LCMS and sample preparation.